Thank you very much, Katie. Welcome everyone to our breakout session where we'll be discussing chapter 1, which is the introduction by Pauline. And the second part will be on chapter 6 on ASRH and services and interventions, which I will take you through. So my name is Bishara Ali Hussein from Somalia, currently pursuing my master's in public policy and also an intern at the Umbrella of Hope Foundation. So I will give this chance to my colleagues, Pauline and Marie and Katie, to introduce themselves before Pauline takes us away through introduction. Thank you.
Hello, everyone. My name is Maria Tolka. I'm a reproductive health advisor and supporting adolescent sexual reproductive health programming as well with Save the Children. Great to be here.
Hi, everyone. I'm excited to join this breakout group to see Basharo and Pauline in action. My name is Katie Meyer. I am the roving ASRH specialist for IWAG.
Hi, everyone. I am Pauline Anyona from the Organization of Africa Youth Kenya. So we'll jump right into our introductory session. So Bishara, kindly take us to the next slide.
Katie, please share the next slide. Yeah, thank you.
Okay, so we encourage you to we would like to get to know you, so kindly introduce yourself on the chat box so that we know who we are dealing with and where you're coming from, plus your organization. So I'm going to take us through the introduction on, we are going to cover the foundational issues of the toolkit. First, we are going to introduce adolescence. So we know that adolescence is the transitionary period between childhood and adulthood. And while the UN describes it as the age between 10 to 19, we choose, or rather the toolkit chooses to not limit it to just age, but also explore other variables that define adolescence, such as sex and gender. So adolescent sexual and reproductive health refers to the state of physical, emotional, mental, and social well-being in relation to all aspects of sexuality and reproduction amongst adolescents. So the toolkit also further goes to describe different subgroups of adolescents that are increased risks. So these are the most vulnerable groups amongst adolescents regarding their sexual and reproductive health. So we have the very young adolescents, and I'm not going to dive much deeper into the description, so the nitty-gritty, so I'll just give a highlight. So we have the group of, one of them is the very young adolescents. We have the orphaned adolescents or unaccompanied minors and adolescents that are heads of households. We also have adolescents who are at risk of sexual exploitation through transactional sex, especially in households where we have adolescents as the heads of households. This is very much rampant. We have married adolescents, and these face a higher risk of intimate partner violence and forced sexual intercourse. We also have pregnant adolescents and adolescent mothers, and these one of the leading causes of deaths among adolescents are deaths that result from unsafe abortion due to adolescent pregnancies. So we have this group of adolescents being among the most vulnerable. We also have adolescents with disabilities whose security and physical barriers are more revamped. So these adolescents fall under this category. We also have adolescents with diverse sexual orientations and gender identities. And in most of our communities, this is a group that are still living in denial or have not been socially accepted. So they also face a social protection issue regarding their sexuality, and that also limits their access to these adolescent sexual and reproductive health services. We have adolescents with diverse SRHR needs, and amongst these we have those who are living with HIV and AIDS, and also survivors of gender-based violence. So the toolkit further goes to describe, to explain a social ecological model that describes the different factors that act as barriers, and also that if promoted can lead to good sexual and reproductive health practices among adolescents. So these are grouped into 4, and the first amongst them is the adolescent level factors. So these are the factors that emanate from the adolescents themselves, or the adolescent as an individual. So they are their biological and personal attributes, what they believe in, their attitudes, and also their experiences, their former experiences while trying to access SRH information and services within their families, communities, and the health systems. So these could be factors such as age, personality, sex, mental health, agency, and awareness, amongst others. Next, we have interpersonal relationship level factors. So these are factors that define the relationships that adolescents have with the family members, their partners, peers, and community members, and also the relationships that they have within their social networks. So these also play a big role in shaping the adolescents' ability to seek SRH services. And amongst them are their beliefs, their knowledge, and their norms, and also the values that influence how they seek information and services. Next, we are going to explore the community level factors. These are defined by the factors that the adolescents are defined by the conditions in which the adolescents live, and the communities within which they socialize, and they're made up of the schools, their workplaces, and their neighborhoods. And we find that these factors in a way shape the way they're able, or how much of access they have, or how much freedom they have in choosing maybe their methods that they want to use for their sexual and reproductive health. And to finish up, we are going to explore the structural level factors. And these are levels that are defined by the infrastructure and the systems that surround the adolescents, and also their ability to attain the information that they need. So much more of this can be, you can, if you want to get much more information about this, you'll get it from chapter 1 of the toolkit. And I hope you'll get time to review it and further know or dig deeper to get more information, because I've just given a sneak peek of what's in the toolkit. So I'd like us to take the next few minutes to just discuss, and I would like to hear from you how you think your organization will use the guidance or tools from this particular chapter to advance adolescent sexual and reproductive health. So kindly, I'm going to give Bishara to the opportunity to maybe unmute, or you have the ability to unmute yourself from the...
Yes, please, Rowley. Thank you very much for taking us through that. Please,
Okay.
participants, if you have answers to Pauline's questions, you are welcome to raise your hands. And if you're comfortable chatting, sending us a message on the comments, please do so. We would love to hear from you in regards to that. Thank you.
Yes, so my first question is how you think your organization will use the guidelines from the toolkit to advance, especially from this chapter, to advance adolescent sexual and reproductive health. Yes, so please feel free to interact. It's open, and all your thoughts and all your ideas are welcome. You may also type out your answer in the chat box.
Yeah, maybe if Pauline, I will start while others are joining us. This toolkit can enable my organization use, data and statistics, from the tool to advocate, for increased funding, or, prioritization of adolescent sexual reproductive health rights activities. I think it can be useful in that aspects.
Mm-hmm. Yeah, and also from my end, the guidance from the toolkit based on the different subgroups will help my organization in outreach activities and reaching out to the different subgroups of adolescents that are more at risk. And the definitions of the different subgroups amongst adolescents is also clear. So it will be very important in shaping our outreach activities.
Yeah. I see Molly has commented. Thank you, Molly. Molly says this information will be very helpful for advocacy purposes. Very true. It will help organizations to advocate in that regards. Pauline, there's someone else commented. Please go ahead.
Oh yes, I can see Pankaj from UNFPA Nepal has said that regarding the global pandemic, it will be helpful to generate data and reach targeted population. Yes, thank you, Pankaj. We encourage more of your participation. You may also unmute yourself and just let us know what you think, and give us also the opportunity to hear your voice, please. Yadanar from UNFPA also says it will be helpful, it will help the program manager to develop and design context and population tailored programs. Yes, and that brings me to our next question on how you can adapt the programming to address the unique needs of the adolescents. Now that Yadanar talked about the design and context of the programs, so how can you adapt your programming to address these unique needs of adolescents? Bisharo, Mary has commented also on the, we have two new comments.
Mary says this toolkit will be more helpful to us in implementing right interventions for our youth. Exactly. It is a very crucial, toolkit to enable any organizations to be able to reflect and see what is the best intervention regarding different ages of adolescents. And Anna says, generally, the toolkit will help my organization in our ASRH programming. Very true. So thank you very much. Keep coming, keep commenting and so forth. And I think we can continue having this discussion after we go through also section 2, so that we can be able to also understand what happens in or what is chapter 6 entailing, and then we can discuss further on the same.
Okay, so Bishara, you're on mute. Please unmute.
Yes, Katie, are you able to take us to the next? Yes. Thank you very much. Thank you very much, Pauline. Pauline has taken us through very important part of this toolkit, which is the introduction. And now I will take you through chapter 6, which provides, provides guidance on how to implement the priorities of adolescent sexual reproductive health activities, as well as services and interventions, with different levels of influence. So in line with the IAFM global standards for quality healthcare services for adolescents, and also from the WHO, the humanitarian health staff should, be implementing an appropriate package of adolescent sexual reproductive health services, as well as stocked and welcoming facilities and other entry points with competent staff, and also in collaboration, with community stakeholders, and most importantly, adolescents themselves. So to achieve that, this topic, this section focuses on 5 elements, which is adolescents-friendly services, training and capacity building of staff, facility-based services, community-based services and outreach platform, multi-sectoral, linkages and referral. But in our break group session, as you can see here, we will discuss the 3 main, the 3 first elements. So first, in regards to adolescents-friendly services, we see this element basically describes 5 principles of adolescence-friendly services in this very colorful, table that includes examples and applications of these principles in humanitarian context. So the principles include accessibility, very important. It emphasizes that agencies or facilities must ensure, their policies and procedures are in place to ensure health services are free and also affordable. Why? Because many adolescents in humanitarian settings mostly have limited financial resources, while others even, work to support their families. Also, there's this essence of facilities to be open in convenient working hours. It can be morning, it can be evening, or preferably 24 hours. Why is this? It's very important because you are able to accommodate adolescents who may be taking additional responsibilities. It can be they are maybe working part-time, or they're taking vocational skills or attending other kind of activities like childcare. Also, it's very important in terms of adolescents being informed on the range of SRH services available and how to obtain them. I remember when I was working with UNHCR in Somalia, I was supervising our then partner, GMF, who are providing, medical services to asylum seekers and refugees in Galkayo. And for them to ensure that adolescents and the rest of the population, the refugee populations, are aware of the services offered at the hospital, they hired community health outreach mobilizers who are, went from house to house to raise awareness and inform the community of available services. And, the time they were available and the contact details and so forth. So they also ensure that this community mobilizers were their own people. They trained them, they capacitated them, they were accepted so that they can break this cycle in regards to medical issues. The same thing as we saw of our case of Elo, whereby she was able to receive this information due to accessibility from the outreach team from the Umbrella of Hope. The second one is very important, is acceptability. Here there must be emphasis on agencies, to confidentiality policies and procedures where, no information without consent of the patients should be shared with anyone, and they must be kept in, safe places. Also, the essence of delivery points being comfortable, private, and safe for adolescents to share their information. And very important for us and health workers to not be judgmental. They have to be considerate and easy to relate. And the third principle talks about appropriateness. What do we mean here? We mean that all adolescents, regarding of their identity, mental and physical capacity, diversity or diverse sexual orientation, gender identities, and so forth, should be able to receive health services, that address their SRH needs from that facility or any other points. It can be MCHs where I have worked with in Somalia, also in Uganda. Of course, one should know in humanitarian settings, not all facilities, can provide all services. Therefore, engaging and strengthening a referral system and coordination is very crucial at this point. The fourth one is equitability. So basically, according to humanitarian principles, any organization should establish procedures and well-written policies that ensure no factor, that is age or social status or disability or ethnic origin, etc., can hinder the provision of services for adolescents group. And lastly is the effectiveness. Everyone should know adolescents are homogeneous groups and so forth. So regarding our next element on training and capacity building, very important, this section provides training, guidance, and tools for building capacity on SRH managers, in addition to material for them to train service providers and community health workers, very crucial. Also, this section also provides, guidance on conducting orientation for non-health staff to ensure holistic programming across all humanitarian sectors, so that this aspect is mainstream everywhere, so that everyone will be able to provide this a safe and supportive environment for adolescents. Our last element is and facility-based. So this element discusses all SRH available to adolescents at health facilities, as well as those connected to the health facilities, such as mobile health team, telemedicine, and also self-care approaches. So the facilities should be able to include a diverse range of providers and support staff, including a range of age and also gender, because adolescents may feel comfortable, speaking to providers of same age and so forth. So most importantly, also a major tool is included in this section of ASRH health facility checklist, very important, which can be used to assess how responsive the facility is to adolescents' needs, and can be used, to monitor quality of SRH services and information provided to adolescents. The toolkit checklist includes those ones from WHO standard and so forth. So they're different. You can choose based on what is effective for your programming. So this leads me to my questions now. How do you think your organization will use the guidance and tools from this chapter? What do you think? What is your organization going to pick from this chapter? How is it going to use this as a guidance? We'd like to hear from you. Please feel free to unmute yourself. Pauline, you can also help us hear. Anyone in the comments, participants, feel free to answer us. I will also pose just my second question too, so that you will be able to maybe also discuss on that. The other one is about, there's this limited data on telemedicine and self-care approaches being used to increase sexual reproductive health access and use of adolescents in humanitarian settings. So how can we use this toolkit to advocate for more of this work? So for those who are not maybe very much aware of the telemedicine toolkit, this is whereby SRH partners or staff or programs have been using digital technologies like mobile devices or computers to access healthcare services remotely. So it has really helped organizations overcome access to barriers, and improve access to health facilities. So I've seen many organizations, MSF, Save the Children, all these organizations using this to reach hard not to reach areas. Thank you. Yes, I have seen. Pauline, you see comments? Yes, thank you.
Yeah, I've seen a few comments. Patricia says that asks a question like, how will the toolkit be more effective at vulnerable young people? So the toolkit, how can it be more effective for vulnerable young people, I guess? So the toolkit can be used, that's basically linked to the question. So as organizations, we are going to first domesticate the toolkit to our context, and then we are going to know what specific issues or what vulnerable groups exist within our communities. And then from then, the toolkit provides guidance on how we can handle each group and what can be done for each vulnerable group, or it addresses the issues that each vulnerable group goes through, and gives strategic examples or directions on what can be done to these particular groups. So for the vulnerable groups of young people that are highlighted in the toolkits, we'll have guidelines or roadmaps on how to tackle each or how to handle each group of vulnerable adolescents that are highlighted. So I hope that answers your question, Patricia. And Mary says the toolkit will help in seeking support from governments. Government policy-making bodies and other stakeholders to mainstream adolescent sexual and reproductive health interventions. Yes, that's very true, because you can use the toolkit to lobby governments to chip in, or what do I say? You can use it as a tool to lobby government for the rights of adolescents in your area, depending on the given sexual and reproductive health needs. Bishara, you may go ahead.
Yeah, thank you. It is true. Also, yeah, Yadaner from UNFPA is saying it is useful to strengthen the supply side, healthcare providers, and also demand side, getting feedback, from adolescents. Very true. The toolkit will be able to raise awareness or give information to adolescents. On the other hand, they will be able to understand their rights. They'll be able to understand what they are going through and how they should be able to claim these rights to the duty bearers or to people responsible within their communities to provide these services. So very important. Lavina here says the information in chapter 6 would guide us in the discussions and advocacy efforts with relevant stakeholders in using effective approaches. Very true. I can't agree more. Um, Mr. Alex also here says it is very helpful, especially to us who are from remote areas and we don't have complete access to these SRH guidelines and toolkits. It will help us present by presenting this to our local agencies and stakeholders so that they can act to provide these basics needs to young people. Very true, Mr. Alex. All of us, the toolkit has been all information that is incorporated is from different stakeholders who are providing relevant services or information or have done research on the same. So ensuring that you present this to people who are responsible to provide basic services to people, that is what this toolkit is providing, the baseline to ensure that these services are actually provided at the time that is relevant and also with quality services that is needed by young adolescents, especially in humanitarians who mostly when we have this kind of crisis, this adolescent sexual reproductive health is always the last resort. Many people don't look at this. They prioritize shelter, they prioritize food, they prioritize, legal services and so forth, and they forget that these young people are also having issues that really need to be addressed immediately during crisis. Maria here also says, thank you all. These are great examples of how you can use this toolkit at your own context. In addition, I want to bring our attention that you will find numerous practical and operation tools to download and use of course, day to day. Thank you, Maria. We would also love to hear from you. Please speak up, raise your hand. Thank you. Yes, please, Pauline, go ahead.
Yes, and we can also use the toolkit as a training tool within our organizations and also with maybe within our networks, and also to capacity build staff who are offering these services. Our center for this chapter was, we had the principles of adolescent-friendly services. So the guidance from this chapter will go a long way in training the staff who are offering these services to ensure that they give quality and quality service to the adolescents, and that is very friendly, so that these adolescents are able to freely seek these services, and also the centers for where these services are offered are also open, so that we have more adolescents seeking adolescent sexual and reproductive health services. Yes.
Thank you, Pauline. Very true. Manang here says, hey, maybe it helps not only for the supply side capacity to increase services, but also the readiness of demand side beneficiaries. Very true. Who will receive the benefits most? True. When they're able to receive these services, they're able to make informed decisions about their health rights, and have quality life that they can be, happy about. Yes, Maria also says that we also welcome feedback from all of you in the years to come. Suggestions to keep improving are crucial as well. Very true. Yeah, anyone has examples of how they have, used the telemedicine aspect of increasing SRH services? Have you used social media, to reach more people? Have you used, virtual aid, Zoom or whatever kind of technology, to reach people in inaccessible areas? you know. I remember the toolkit provides these adequate sources and cases, you know, examples of how this telemedicine has been used. I remember during Typhoon Haiwan, humanitarian responders used telemedicine to provide, you know, onset patient examinations while communicating with doctors in the USA. Also in Guatemala, we saw community health nurses call, you know, into a weekly teleeducation conferences or with experts at Children's Hospital at the University of Colorado Center for Global Health. So what kind of examples do you have, you know, or your organizations have used in regards to this? And do you think it's important to continue, you know, using these creative digital technologies? Do you think they are very effective? Pankaj here from UNFPA says this toolkit will enhance SRH interventions for vulnerable young population and strategies to increase the utilization and the effective on health outcomes. Very true. I agree.
Yeah, and Bashar, I was just going to add that I think people probably have a lot of examples from COVID because we've had to shift to so many different innovative methods to reach adolescents and young people. Several people, maybe including on this breakout group, may have been involved in IWAG's crisis management workshop series. We heard from a number of youth-led organizations that said that they needed guidance on how to deal with the closing of their office. How do you communicate safety to your staff? And they were smaller organizations, so they didn't have this guidance available. So we set up a 3-part webinar series, and it was really amazing to see the turnout from all these different organizations. But we would have never been able to reach all of these organizations if we hadn't been put in a pandemic and been forced to go virtual. So there is a silver lining to some of this mobility restriction that has come along with COVID.
Exactly. Thank you, Katie. I can't agree more. Yeah, COVID-19 pandemic has shown us the usefulness of using this digital technology aspect, you know, where all of us or most of us have adapted to these training strategies of using remote or virtual blending learning, you know, approaches, you know, while also ensuring that we apply this infection prevention and control measures to prevent transmission of the virus. So this is a very good also example that all of us are, you know, aware or implementing it at the same time. Anyone else? Pauline?
Thank you, Bishara. I can also add on what Katie shared, like more specific on facility-based services. This is Maria Cholka. Like I know, like Save the Children and other organizations are also looking on how they can enhance facility-based services around counseling, for example, for family planning through telemedicine, and that includes also adolescents and youth, and how we can make like pre-made like packages for adolescents, like to have access and then follow up with a one-to-one telemedicine session. So we are very excited to think about the future of this and how it might shift also the provider's bias and other barriers that adolescents face around accessing services, especially in humanitarian settings. So we definitely invite like anybody to share these experiences in the future.
Thank you, Maria. Very correct. You know, it's very, these are all good examples that we are seeing now, you know, that SRH service providers are ensuring to use and take opportunity of it so that they can implement, you know, their projects effectively. Manang also said, in addition, one more crucial point to put in place, the policy and program of SRH services as integrated into any development humanitarian program as well. Very important. Yeah, because these policies and programs are, they enable us to ensure that the procedures are embedded within our institutions or embedded within the structures that we have to ensure that they are able to to act as a baseline or guidelines for us during implementation of this humanitarian program. So awesome, everyone. Thank you very much for participating in our session. I think we have few minutes before our breakout session goes. Very important topic that we discussed today. Do you have any questions, please? Anyone? Yeah. Okay, if we have no questions, thank you. We have gone through the chapter 1 of introduction and the chapter 2 and the chapter 6, of adolescent sexual reproductive health services and interventions, which will enable us, design and implement, and also assess, monitor, and evaluate our programs on ASRH during our humanitarian interventions in crisis and also in emergencies, and also in protracted situations and after also the crisis. So kindly get to use the toolkit for designing, and programming your ASRH. Also to speak out, and advocate for adolescents in your context, and push duty bearers and stakeholders and organizations working in humanitarian crisis to integrate and embed it within the existing health, institutions. Also for you, I think my takeaway and most of our takeaway should be, being agent to this role, and we should play it, with this commitment, under the toolkit to translate it into our agencies and where we work, and also most importantly at the national level. Action, we should recognize that ASRH as part of the universal health rights, and having this tool is not the end, of our work, but our work is to continue to push strongly for this tool to be used and implemented everywhere in the world, and more so, promote health and happy sexual reproductive health for young people and adolescents. Thank you very much. Pauline, do you have anything else to say before we end up?
Yes, just to encourage our actors who are present to promote the toolkit, and as my colleague has said, domesticate it as needed or as appropriate in your context. And yes, continue to do the good work that you do, and defining the different groups of adolescents that will help in knowing what kind of interventions you need to shape, and not leaving any population behind. And it goes a long way in enabling us to achieve the global goals by 2030. Yes, thank you.
Thank you very much. Thank you all for participating.
Yeah, thank you so much, Basharo and Pauline. We'll be rejoining the main room in a few seconds. You can see on your screen that you have the option to leave the breakout room now to join the main room. Thank you.